Welcome to Transition University. In this module, we will be talking all about safety. One aspect of healthy living that we are going to talk about in quite a bit of detail is safety. There are many areas of safety we need to think about as we transition into adulthood and become more independent. As we access our communities, we encounter more people and a variety of situations. We must keep ourselves and our loved ones safe. We will talk about the following areas of safety: home, online, in public, at work and at school, in areas where there might be abuse, neglect, and exploitation, and also with our encounters with police and crisis workers. Safety at home. The Utah Center for Assistive Technology and Independent Living Centers can help make a home more accessible for individuals. They can help us address where there might be areas for slips, falls, and injuries, locking doors for security, answering the door safely, using appliances safely, medications, and emergency plans. Practice to achieve proficiency with this skill is also imperative. As we discussed last week, practicing each of the skills necessary with our young adult, and remember to fade support as they gain proficiency. Practice locking the door inside and outside of your home. Discuss the importance of keeping track of keys. Develop a system where keys are easily accessible. Consider adaptive keys or no-key electronic codes if they are easier and safer for your family. Ensure you are practicing for crisis events, for instance, natural disasters, medical emergencies and accidents, and have supplies on hand ready in the event that they are needed. Think of the earthquake we had a few years ago. What might you need to have in place at your home to be prepared? What are some ideas of safety measures? Well, let's have discussions about social media, appropriate texting, phishing scams, protecting personal information, limiting hours online, and avoiding addiction. Establish ground rules to limit the potential negative aspects of our digital world. Practice with trusted family and friends first. Establish boundaries regarding appropriate times to text or call, as well as clearly define the amount of time the youth is allowed to spend on electronic devices each day. Clear boundaries from the beginning are important and will aid in successfully transitioning to the social media-driven world we all live in today. If someone threatens you, do not respond. Go tell a trusted person as soon as possible. If something scary comes up on your device, go tell a trusted person. Limit your hours and make sure you don't become dependent on social media. Discuss attempted phishing scams and what they may look like. Teach to think twice before clicking on links. Online connections can be a great asset. We just need to make sure we balance it with our health and our safety. Additional ways parents can maintain some oversight over their children's internet activities are to set up parental controls to allow web filtering. This can be done in several ways, including through your internet provider or cell service contract. Directly on the device, the instructions should be in the manual, and through site-specific services offered by popular sites including YouTube, Netflix, and Facebook. Review the browsing history regularly. Disable location sharing on mobile devices. A GPS-enabled smartphone can reveal your child's location through online posts and uploaded photos. Discuss what information is appropriate to post and share with the world. Teach your child that information shared on the internet is not private. Review information that should be shared, personal details, passwords, credit card numbers, etc. Explain the limits to online relationships. Emphasize that it's okay to say no to requests for personal information, photos, money, and joining social media networks. Encourage your child not to delete messages, including those that are hurtful or don't feel right. Tell them to save anything they're not sure about and set aside time to review the messages together. Ask questions. What websites do you like to visit? Have you ever seen something online that made you feel sad, scared, or confused or uncomfortable? What would you like to do if you saw something online that made you uncomfortable? Learn how to use the social media websites that your child is using. Ask them to show you how it works and specifically how they use it. This information can be found at from the Children's Hospital of Philadelphia in their resource information. Staying safe in public. There is a changing technology for preventing elopement from home and to locate someone once they have gone. It is best to research when you are ready to buy because it changes rapidly. Low-tech options can be used as well. It just needs to match the individual's needs and abilities. Elopement prevention technology, for instance, watches and phones, can be used. You can also use trackers on phones or in backpacks to quickly see where your family member is. Apple AirTags are relatively new technology, and that's quite affordable. Transportation, set standards for who it is safe to get a ride from. If they are going to use public transportation, practice before they go on their own. Even if they are not going to ride on their own, it is a great way to go over rules repeatedly in case you ever get separated. If they are going to get a driver's license, discuss all the requirements associated with the process. Consider if the license will be unrestricted. Will the individual drive in the snow, rain, or dark? If so, will they need ample time to practice in a variety of conditions? Transportation, again, who is it safe to get a ride from, whether that's public transportation or whether they get a driver's license. There is a driving simulation program. If your child is interested in driving and isn't signed up to take driver's ed at school, check to see if your child would be a good fit for this program. In school and other government programs, staff are required to undergo background checks in order to work directly with individuals with disabilities. That is just one safeguard and does not guarantee safety and protection. It is important that you know and have a personal relationship with people in your setting so that you can feel safe and comfortable. It is also important that you maintain professional boundaries with staff. That is sometimes difficult because we do become friends with the people who work with us and they become involved with our families. But it is essential that we always remember that they are paid to help us and anything inappropriate or of concern must be reported. Know your staff. Who are the trusted adults in every setting? Be aware of emergency plans and exits. Know emergency phone numbers. Have a safe meeting place and know your rights and how to report problems and concerns. A law was just passed in Utah that requires special needs and autism training for all Utah police officers. Contact your local police department and see if they have crisis intervention teams. Ask if they have a way for you to share critical information before there is a crisis. If they have a crisis team, you can request them during an emergency. Any work we can do to get to know and interact with our local police prior to calling them an emergency will be time well spent. Understand what crisis teams they have for emergencies. Some important questions to ask are, who comes out if I request a crisis team? If the crisis team is available, are they available at all times, or do they only work certain days and times? Who in my local department is trained on disabilities? Do they have a program where we can put our information in their system prior to a call? Families can also consider bracelets or tags with emergency information on it to help first responders in a crisis situation. There are also programs like Florio training, which is virtual reality training to help youth with disabilities become more familiar with law enforcement and the commands they might receive from law enforcement. So guarding against abuse, this is a serious topic, and our disability population are at risk for being abused. Those with disabilities are subject to higher incidents of abuse, and this means we need to be proactive in prevention and having ongoing discussions about staying safe and happy. Be very specific about what different types of issues can arise. The independent living centers have classes on maturation and sexuality, as well as developing independent living skills. Sometimes young adults need permission from trusted adults because they have been taught to be compliant and obedient in other areas of their lives. So yes, please obey and don't talk back when I'm telling you to go to bed, but scream, kick, and fight if someone is trying to hurt you. Do you see the difference there and how they might be confused? We need to give them permission to behave differently if they are in danger. Many of us are familiar with the definition of physical abuse. However, it also includes intimidation. It is important to document the details of the situation and where abuse took place. Take photos of bruises caused by pinching, biting, hitting, slapping, etc., and report the encounter immediately. Sexual abuse prevention is incredibly important to individuals that no one should touch them in private areas without permission. Discuss what that means specifically. Anything covered by a swimsuit is one example. Online abuse refers to threats, coercion, bullying, or the inappropriate distribution of photos or information online without appropriate consent to do so. Financial abuse includes using an individual's resources illegally, for instance, food stamps, SSI, Medicaid, and drug and alcohol use abuse is a topic that requires a conversation about appropriately taking one's medication, guarding against theft and misuse by others. In addition, when a person is of legal age to consume alcohol, or a discussion about doing so safely is appropriate. For children under 18, you can report abuse to Child Protective Services. For those over 18, you can call Adult Protective Services. There are links to both of these resources in our youth work booklet and our choices work booklet. And there's also an emergency number. Youth can always call 911. We are also providing links to our training on dealing with police encounters on our resource sheets through our training classes and also in our work booklets. Behavior is communication. It could mean something is happening or that there is a medical need that requires addressing. If there is ongoing anxiety and being upset, it is worth looking into what might be the cause. Sudden changes in behavior, broken bones, cuts, bruises, burns, complaints about painful genitals, constant hunger or thirst, dirty hair or skin, chronic diaper rash, which is not due to a medical condition, are all aspects of abuse that need to be investigated. If you have questions, please refer to the red section of our choices and our youth work booklets, or also call the Utah Parent Center, and one of our consultants can help to find you resources for the area of concern that you have in your life.